Hello, Professor. My name is Joaquín. Today I will be talking about medical marijuana and why insurance companies should be covering the cost. Many people have been in a situation where they go to the pharmacy to pick up their medicine, then to be told that their insurance is not covering it. Over the years, certain programs and initiatives have been introduced to reduce the cost on consumers. However, there is still a large population that is being forgotten: medical marijuana patients. When people think of marijuana, the image that the media has displayed often comes to their mind: a lazy stoner or a hippie at a festival. However, in recent years, the medicinal properties of marijuana have been studied and have been shown to be effective for reducing anxiety and inflammation, as well as acting as an appetite inducer. As medical marijuana continues to evolve, it is important that the insurance industry also adjusts and begins to cover the cost burden of this, so it does not solely fall on the patient to pay out of pocket. My credibility on this topic is based on extensive research and discussions with industry experts. My proposition is that insurance companies should cover the cost of medical marijuana. I will discuss the medicinal properties of medical marijuana, how this is a substitute for other pharmaceutical drugs, and then go into why insurance companies should cover these costs. Marijuana has several medicinal properties that can benefit people with various illnesses and symptoms. I will discuss two uses below. Marijuana can be used to reduce anxiety, depression, and stress because it can create a calming experience for the user. Medical marijuana is used by cancer patients because THC has properties that can kill cancer cells, and it can increase appetite in a patient who is going through chemotherapy. Furthermore, medical marijuana can be used for appetite loss, Crohn's disease, eating disorders, epilepsy, glaucoma, muscle spasms, nausea, and pain. While medical marijuana is not the solution to all of life's problems, it does provide an alternative to patients. When a person has anxiety, they're able to see a psychiatrist, and in many cases, they are prescribed some sort of anti-anxiety medication. There are many types of anti-anxiety medications, including, but not limited to, Xanax, Lexapro, Prozac, Valium. A study from 2008 showed that 1 in 10 Americans were prescribed psychotropics, a number that research suggests has grown drastically since then. All of the anxiety medications have shown signs of various side effects, including confusion, headaches, depression, nausea, dry mouth, and sexual dysfunction. Medical marijuana is not without side effects. However, it is an alternative that should be treated seriously and with the same respect that is given to other pharmaceutical drugs. As the medical marijuana industry grows, the ways in which marijuana is consumed evolved, and the patients can now consume pills, droplets, gummies, vapes, and infused drinks, to name a few. Many people who have started to prescribe medical marijuana prefer this to treat them, as opposed to other drugs that contain harsh side effects and provide a zombie-like feeling to patients. As validity is given to medical marijuana as a real alternative to other pharmaceutical drugs on the market, the insurance companies must begin to adjust and seriously look at taking on some, if not all, of the cost burden. Health insurance is a basic right, And in a country where people are highly medicated, the insurance company should not make a decision on who and who isn't covered. We need to reform the insurance industry so that medical marijuana is covered on a broad scale, instead of forcing patients to cover these often highly expensive costs out of pocket. Medical marijuana is not the solution to every problem. However, it is a real alternative and a substitute to pharmaceuticals that are in the market. And the medicinal properties have life-changing effects on users. The medicinal properties of marijuana should not be ignored, such as they cause a decrease in anxiety, a reduction in depression, and have hunger-inducing effects. Individuals who prefer this as an alternative should have the support of their insurance companies to cover the cost, so that they're able to make a decision that's not solely based on the cost, but rather what they and their doctor agree is the best approach. Insurance companies should cover medical marijuana because it helps patients and is an alternative that individuals should be able to use without solely thinking of the cost. In a country where we are quick to medicate people, we seem to be very slow to reform the insurance system that only benefits some and does not evolve with the times. Medical marijuana is an alternative that should be given the same respect and thought as other pharmaceuticals on the market. Furthermore, we must see to it that insurance companies step up to help cover the cost of this alternative so that the burden does not fall fully on the consumer. The consumer should be focused on their own health and getting better, not on the cost of their medical drugs. Whether they choose medical marijuana or a drug like Zoloft, they should have the option and the support of the insurance companies. Thank you.